Hi friends, welcome to the channel The Nurse. Here we are discussing about hard exam questions for nurses. Hard means Health Authority of Abu Dhabi. Hard exam is compulsory for nurses who are interested to work in Abu Dhabi. So question starts now. Before that, if you are not subscribed to our channel, please subscribe. First question. Which of the following pulmonary term correlates with the definition noted obstruction of trachea or larynx? Which of the following pulmonary term correlates with the definition noted obstruction of trachea or larynx? Bronchi, stridor, venous, vesicular. The correct answer is stridor. Next question. The essential fatty acids that must be derived from the diet are. The essential fatty acids that must be derived from the diet are linoleic acid and alpha linoleic acids. Linoleic acid and alpha linoleic acid. The essential fatty acids are required for human metabolism. The body does not produce linoleic acids, that is omega 6, and alpha linoleic acid, that is omega 3, and they must be derived from the diet. The essential fatty acids are required for human metabolism. The body does not produce linoleic acid and alpha linoleic acids, and they must be derived from the diet. That's why it's called essential fatty acids. These are also known as polyunsaturated fatty acids or PUFAs. Omega 3 and omega 6 fatty acids play vital role in brain function as well as normal growth and development. These also known as polyunsaturated fatty acids, that is PUFAs. Omega 3 and omega 6 fatty acids play vital role in brain function and as well as normal growth and development. Next question. Fruits, vegetables and cereals are potent source of. Fruits, vegetables and cereals are potent source of antioxidants, unsaturated fat, saturated fat, free radicals. The correct answer is antioxidants. In addition to the mentioned foods, legumes, that is broad beans and soya beans, are good source of antioxidants. Vitamins and a variety of phytonutrients that often act as antioxidants, protecting the cells of body from the damaging effect of free radicals. In addition to the mentioned foods, legumes, examples broad beans and soya beans, are good source of antioxidants. Vitamins and a variety of phytonutrients that often act as antioxidants, protecting the cells of body from the damaging effect of free radicals. Some of the best sources of antioxidants are berries, ginger, pomegranate, sunflower seeds and walnuts. Next question. Risk factors for type 2 diabetes includes all of the following except. Risk factors for type 2 diabetes includes all of the following except advanced age, obesity, smoking, physical activity. The correct answer is smoking. Additional risk factors for type 2 diabetes are family history of diabetes, impaired glucose metabolism, history of gestational diabetes, and race or ethnicity. Additional risk factors for type 2 diabetes are family history of diabetes, impaired glucose metabolism, history of gestational diabetes, and race or ethnicity. Next question. Type 2 diabetes accounts for approximately what percentage of all cases of diabetes in adults? Type 2 diabetes accounts for approximately what percentage of all cases of diabetes in adults? 55 to 60, 35 to 40, 90 to 95, 25 to 30. The correct answer is 90 to 95%. Type 2 diabetes accounts for the overwhelming majority of cases diagnosed in adults. Type 2 diabetes accounts for overwhelming majority of cases diagnosed in adults. It develops gradually, beginning with insulin resistance, and as the requirement for insulin increases, the pancreas becomes progressively less able to produce. It develops gradually, beginning with insulin resistance, and as the requirement for insulin increases, the pancreas becomes progressively less able to produce. Next question. The risk factors for type 1 diabetes includes all of the following except. The risk factors of type 1 diabetes includes all of the following except diet, genetic, autoimmune, environmental. The correct answer is diet. Type 1 diabetes is a primarily failure of pancreatic beta cells to produce insulin. Type 1 diabetes is a primarily failure of pancreatic beta cells to produce insulin. It primarily affects children and young adults and is unrelated to diet. It primarily affects children and young adults and is unrelated to diet. Next question. Which of the following is the Latin name for Athletis foods? Linea pedis, Linea cubensis, Linea corporis, Linea latinis. The correct answer is Linea pedis. The pedis is from Latin word ped, P-E-D, which means food. The pedis is from Latin word ped, which means food. Next question. Which of the following matches the definition? Which of the following matches the definition? Covering up a weakness by stressing a desirable or stronger trait. Covering up a weakness by stressing a desirable or stronger trait. Compensation, projection, rationalization, dysphoria. The correct answer is compensation. Compensation usually means something awarded to someone as a recompense for loss, injury or suffering. Compensation usually means something awarded to someone as a recompense for loss, injury or suffering. Next question. Which of the following is not one of the key steps in the grief process? Which of the following is not one of the key steps in grief process? Denial, anger, bargaining, rejection. The correct answer is rejection. Next question. What is the therapeutic range of phenytoin? What is the therapeutic range of phenytoin? 1.2 to 2 microgram per ml, 5 to 10 microgram per ml, 10 to 20 microgram per ml, 20 to 30 microgram per milliliter. The correct answer is 10 to 20 microgram per milliliter. Next question. Which of the following method is adopted for opening an airway in suspected spinal cord injury? Which of the following method is adopted for opening an airway in suspected spinal cord injury? Head tilt method, chin lift method, jaw thrust method, Helmich method. The correct answer is jaw thrust method. All other methods cause pressure over the spinal cord. Pulling the jaw never exert pressure over the cervical cord. All other methods cause pressure over the spinal cord. Pulling the jaw never exert pressure over the cervical cord. Next question. A client has undergone an attack of head injury. At present, he is not able to talk but able to understand everything. Which of the following lobe of brain is involved? A client has undergone an attack of head injury. At present, he is not able to talk but able to understand everything. Which of the following lobe of brain is involved? Frontal, parietal, temporal, occipital. The correct answer is frontal lobe. Expressive speech center is Broca's area and is located in frontal lobe. Expressive speech center is Broca's area and is located in frontal lobe. Which of the following termed as widowmaker artery? Which of the following termed as widowmaker artery? RCA, LCA, LAD, diagonal artery. The correct answer is LAD. The left anterior descending artery carries fresh blood into the heart so that the heart gets oxygen it needs to pump properly. the left anterior descending artery or LAD artery carries fresh blood into the heart so that the heart gets the oxygen it needs to pump properly. If it is blocked, the heart can stop very fast. That is why the type of heart attack is called widowmaker. If it is get blocked, the heart can stop very fast. That is why this type of heart attack is called widowmaker. Next question. Which of the following is the most common cause of restrictive cardiomyopathy? Which of the following is the most common cause of restrictive cardiomyopathy? Alcohol, hemochromatosis, amyloidosis, sarcoidosis. The correct answer is amyloidosis. Amyloidosis is when an abnormal protein called amyloid build up in tissues and organs. Amyloidosis is when an abnormal protein called amyloid build up in the tissues and organs. When it does, it affects their shape and how they work. Amyloidosis is when an abnormal protein called amyloid build up in the tissue and organs. When it does, it affects their shape and how they work. Next question. Metformin should be withheld prior to coronary angiography because the risk of. Metformin should be withheld prior to coronary angiography because the risk of hypertension, lactic acidosis, allergic reaction. The correct answer is lactic acidosis. Metformin is associated with lactic acidosis in patients with conditions that can themselves cause lactic acidosis. The conditions are heart failure, hypoxia, sepsis. Also, in renal insufficiency leads to metformin accumulation is another reason for lactic acidosis. Also, in renal insufficiency leads to metformin accumulation is another reason for lactic acidosis. Next question. Which of the following to be done for a patient showing saturation of 88% and a normal respiratory pattern? Which of the following to be done for a patient showing saturation of 88% and a normal respiratory pattern? Start oxygen, check pulse rate, check blood pressure, continue suctioning. The correct answer is check blood pressure. Hypertension causes decreased peripheral circulation and shows false reading in saturation monitor. Hypertension causes the decreased peripheral circulation and shows false reading in saturation monitor. Next question. While using metered drug inhaler or MDI to administer corticosteroid, which of the following action indicate client using it correctly? While using metered drug inhaler or MDI to administer corticosteroid, which of the following action indicate client using it correctly? Head tilts down while inhaling. Wait 5 minutes between puffs. Mouth is rinsed with water following administration. Client lies supine for 15 minutes following administration. The correct answer is mouth is rinsed with water following administration. Mouthwashing after inhalation of corticosteroids is effective for prevention of local adverse effects such as hoarseness and oropharyngeal candidiasis. Mouthwashing after inhalation of corticosteroids is effective for prevention of local adverse effects such as hoarseness and oropharyngeal candidiasis. Next question. Which of the following findings indicate respiratory infection in a client with asthma? Which of the following findings indicate respiratory infection in a client with asthma? Cough with productive yellow sputum, bilateral respiratory wheeze, chest tightness, respiratory rate of 30 breaths per minute. The correct answer is cough with productive yellow sputum. Next question. Physical assessment of a client with advanced COPD. Physical assessment of the client with advanced COPD. Increased anterior-posterior chest diameter, undeveloped neck muscles, collapsed neck veins, increased chest movements with respiration. The correct answer is increased anterior-posterior chest diameter. Increased anterior-posterior chest diameter causes barrel chest. It is the characteristic feature of COPD. Increased anterior-posterior diameter causes barrel chest. It is the characteristic feature of COPD. COPD includes emphysema and chronic bronchitis. Next question. A client began a 6-month course of therapy with isoniazid. A nurse plans to teach the client to. A client began a 6-month course of therapy with isoniazid. A nurse plans to teach the client to use alcohol in small amounts, report yellow eyes or skin immediately, increase intake of cheese or aged cheeses, avoid vitamin supplements during therapy. The correct answer is report yellow eyes or skin immediately. A yellow eyes or skin indicates liver toxicity and sign of jaundice. A yellow eyes or skin indicates liver toxicity and the sign of jaundice. So this question ends here. Thank you for watching this video. Please like and share this video and don't forget to subscribe our channel, The Nurse. Thank you.